Kia ora koutou, and welcome to the subcommittee today. Wonderful, we can see you and hopefully we'll be able to hear you as well. Thank you very much for taking the time to submit today, Cara. We have read your submission, so do take it as read, and over to you for 5 minutes. I'll give you a little signal at 4 minutes.
Thank you so much. Is there something going on with our teenage girls? The answer I would give is yes. Do we know what it is precisely? No. Those are the words of Dr. Erica Anderson, a child psychologist at the University of California's Child and Adolescent Gender Clinic. Dr. Anderson is referring to the over 2,000% increase in girls being referred to gender clinics in the last 10 years. This is typical of medicine. We zig and then we zag, and I think maybe we zigged a little too far to the left in some cases. Those are the words of Dr. Marcy Bowers, gender surgeon. Dr. Bowers is talking about the trend to put ever younger children who are experiencing gender confusion on puberty blockers. Both have treated thousands of gender dysphoric patients. Both are board members of the World Professional Association for Transgender Health, and both are transgender women. Both, I am sure, would have plenty to say about this bill, a bill that is underpinned by a regulatory impact assessment that is severely deficient, fails to critically engage with the subject matter, and does not establish any basis for the inclusion of gender identity or gender expression. This bill ignores the evidence that gender ideology harms children and young people, in particular girls, and that far from being innate, the overwhelming majority of children who experience gender confusion will have that distress desist by the end of puberty if a watchful waiting approach is taken. This bill will actively harm some young people by preventing them from getting the care they need if it continues to include gender identity and gender expression, two terms that neither the Ministry of Justice, nor the Parliamentary Counsel Office, nor Crown Law, nor the Minister of Justice can define, and yet this bill proposes that suppressing these undefinable terms should be punished up to and including imprisonment. The Ministry of Justice's assessment provides no evidence that gender identity conversion practices occur in New Zealand, states in multiple places that there is a lack of evidence, analysis or certainty of impact of banning conversion practices, and makes statements about gender identity that are at best questionable and are at worst demonstrably false. My written submission details all of these, but I will call out one particular component. The regulatory impact assessment asserts that there is no evidence that a person's gender identity is changeable. In this, the Ministry of Justice finds itself at odds with Honourable Jan Tinetti, who stated in June regarding the government's plan to allow the changing of sex on a person's birth certificate multiple times that gender can be fluid and how a person identifies may change over time. The government's position on gender identity is as inconsistent as it is irreconcilable. It claims that for the purposes of banning conversion practices that gender identity is innate and unchangeable, but that for the purposes of sex self-ID on birth certificates it is fluid and may change over time. You have to pick one or none, but you cannot have both. When Western society saw an explosion of eating disorders among teenage girls, we asked questions. When we saw increased self-harm, we did the same. But now when we see an over 2,000% increase of girls wanting to identify out of their bodies, those of us asking questions are transphobic. Gender ideology is not progressive. Instead, it is a regressive ideology that tells confused and distressed children and young people that their bodies may be broken, that binders, packers, puberty blockers, cross-sex hormones, mastectomies, hysterectomies, and phalloplasties are somehow liberating, that a lifelong reliance on the pharmaceutical and medical systems that will likely make them infertile with lifelong sexual dysfunction and at a higher risk of everything from serious cardiac events to some cancers is somehow progressive, and that anyone who disagrees is hateful or transphobic. It has been embraced by pharmaceutical companies seeing a long-term supply chain for drugs developed to treat end-stage prostate cancer and chemically castrate sex offenders, drugs that have never been licensed for blocking puberty in children. And now this bill proposes potential civil and criminal penalties for those who will not participate in the affirmation-only approach demanded. It is here that we return to Dr. Anderson, who states, "It is my considered opinion that due to some of the sloppy healthcare work that we're going to have more young adults who will regret having gone through this process. That is going to earn me a lot of criticism from some colleagues, but it's my actual experience as a psychologist treating gender variant youth. If this bill passes as it is in years to come, when we have young adults who want to know how the medical, education, legal and legislative systems could have channeled them into making irreversible, life-changing decisions before they were old enough to drive, drink, vote, smoke or get married, it will be really clear who tried to protect them. And I hope that includes you. Thank you.
Thank you, Cara, for taking the time to submit today and for what was a very detailed written submission as well. I'm just looking to my colleague, Simeon Brown.
Yeah, thank you, Cara. I guess my, I think, very good submission, also a lot of detail in the written submission as well. So your recommendation would be effectively to drop the bill, or would you be suggesting some particular changes to the bill?
So my recommendation is to strip gender identity and gender expression out of the bill. I have a level of support for retaining sexual orientation, as that's a very different matter, and there obviously have been some harmful practices in the past around conversion therapy and sexual orientation.
Thank you for that.
Thank you again, Cara.
Thank you for your time.